Welcome into Eye on Northeast Kansas, the podcast. I'm your host, Melissa Bruner. This is where we recap some of the top interviews over the past week that you've seen on Eye on Northeast Kansas, the TV show. That show comes to you live, 4 o'clock Central Time, Monday through Friday, from our WIBW TV studios in Topeka, the capital of the great state of Kansas. It has been a busy time on our red couch. I'll tell you, one sign that we are bouncing back from the pandemic, all of the people who want to get on and get in our studio and talk about their upcoming events. It has been so busy around Northeast Kansas with events and activities. I'm sure you maybe have been noticing the same thing where you are. So it's been great to have so many friends visit us on Eye on Northeast Kansas. We also are talking this week about our veterans and the health care that they receive. The VA Eastern Kansas Health System wants veterans to know about their whole health approach. They actually have a seminar coming up to talk about it. They also remind veterans who have served during a certain period of time that the PACT Act has an important deadline coming up September 30th. So Sarah Dernovish and Dr. Cody Shale of the VA Eastern Kansas were on Eye on Northeast Kansas this week, filling us in. So welcome to both of you. And Dr. Shale, let's start with whole health.
Sure.
What does that concept mean?
Yeah, thanks for asking. So when we think about whole health, it's really an approach to thinking about health and healthcare. So oftentimes when you go to the doctor or need something, your physician and your healthcare team really focuses on what's the matter with you. And in whole health, we shift that target to what matters to you. What do you want your health for? What makes you feel alive? And then we work on your health to get you mission ready so that you're able to do the things that really bring you joy.
And you're coming at this from a mental health perspective. Why is that important when you talk about whole health?
Well, many of our health concerns or conditions have a strong behavioral component. We know that the cornerstones of health really have a lot to do with the choices and the behaviors that we make every day. And so some of that involves our outlook on life and the way we see the world, the way we view ourselves. So so taking care of yourself really starts with that sound mind, body, and spirit together.
You know, a lot of people are talking about this, but maybe not so much among veterans. So what do you have planned so that people can learn about this concept and what it means to them?
Yeah, we are so excited. We are hosting our first ever Veterans Whole Health Town Hall. That will be next week on the 28th in Manhattan, Kansas. And we have a beautiful venue. The Blue Sage Barn has donated their space. So we are able to connect with veterans and community members and caregivers, family support systems. We really want to get the word out because we have a plethora of resources in the VA to equip veterans in taking charge of their health. And we want to hear from our veterans what they want in their whole health care.
Do they have to register or is there any cost for that event next week?
No, the cost itself is free. There is no registration required, but we will have giveaways. We'll have some raffles, and so signing up for a ticket is encouraged.
And they can do that when they arrive?
Exactly.
And we'll give you the exact details on the time and where the location is in just a second. But Sarah, I want to shift over to you because this is actually coming at a good time because there is a segment of veterans out there who may be eligible for these services that may not know that, and that's where the PACT Act comes in. What is that all about?
Sure. So the PACT Act is the Promise to Address Comprehensive Toxics Act, and there's a special enrollment period associated with that act that ends in 10 days. It ends at 11:59 p.m. on the 30th of September. And what that special enrollment period is it's for a certain segment of veterans. These are veterans that have deployed to a combat zone and have left active duty between their certain dates between 9/11/2001 and October 1st of 2013. That specific set of veterans has until 11:59 p.m. on the 30th to apply for VA health care. And they can do that without first applying for VA benefits overall. So they can go straight to the healthcare enrollment, they can skip the VA benefit application, and that will allow them to be enrolled for life in VA healthcare. Even if they don't think they need care now, they will still have access to the things like whole health. And 20, 30 years from now, if by chance they do have a condition that pops up, maybe related to the toxic exposures, they'll be enrolled and ready to receive that care.
And we've talked about this before. If you're a veteran who has served in that time period or any of these periods that are covered under the PACT Act, you think, I'm healthy now, I'm not having any issues now. Why is it important then for them to still sign up, or you would encourage them to still sign up?
Yes, absolutely, because what we're seeing with these veterans from Vietnam, Gulf War, post 9/11 even, that they were exposed to the burn pits, Agent Orange, some of these health conditions aren't showing up until 20, 30 years down the line. So what we want is those veterans, like I said, to be enrolled so that we're ready to care for them.
When you talk about whole health, I imagine you're including there are some mental health conditions that can come up years later as well.
Yes, absolutely. It's all connected, and we are understanding the outcomes of that as we work more and more with our veterans in these categories.
Well, if you'd like to go to the segment that they have coming up next week in Manhattan, it's taking place Thursday, September 28th. It's an evening event, 5:30 to 7 p.m. So if you work during the day, take the trip over to Manhattan and see that VA Eastern Kansas, the Live Whole Health Town Hall. You can ask questions, you can learn about resources. If you even have questions about the PACT Act, I do have a link to that page on WIBW.com that you'll see in a moment as well. Dr. Shale, Sarah, thank you both for being here. Always very important information for our veterans. A lot of folks who served out there. We appreciate all of them. Thank you. Remember those deadlines, and remember to reach out to the VA Eastern Kansas if you have any questions or concerns about anything. We're talking a lot about mental health this month, September being Suicide Prevention Month, and then we'll be going into October, which is Mental Health Awareness Month. Family Service and Guidance Center has a great partnership. They've had it now for 9 years with the Texas Roadhouse restaurant in Topeka. They call it Meals for Mental Health. It is a fundraising event that takes place all October long. Pam Evans from FSGC visited the studio to tell us about the fundraiser, but also about an important new addition to their facilities and services that promises to be a big win for Northeast Kansas. Welcome, Pam.
Thanks for having me.
This is the always popular Meals for Mental Health fundraiser. What is the meal and how do we take part in this?
Yes, so 9th annual partnership with Texas Roadhouse. Tickets are now on sale. And this is a really unique fundraiser where anyone in Topeka or Northeast Kansas can go on our website, purchase tickets, and then they get to choose when they redeem them and how. Dine in or carry out anytime during the whole month of October.
If you're watching this from halfway across the country and plan to take a drive to Topeka, you can take part in the fundraiser.
Come to Topeka because it is the Topeka location.
It is the Topeka location of Texas Roadhouse.
Right.
How does it work? You buy the tickets and then what happens from there?
Then you just take your tickets in. Anytime they're open, then you'll get to choose from one of 4 different entree options. Comes with the soft drink and, of course, their amazing rolls.
Oh, it comes with the drink too?
Drink and the rolls.
Well, I know the rolls. We can't leave out the rolls.
You know, the rolls.
So it's a limited menu of 4 entrees, but they are 4 entrees where everyone's sure to find something that they will like, and it runs during the month of October.
Right. They can cash those in anytime that they're open, dine in, or carry out. So really, really convenient.
You don't even have to wait.
No.
You can do the carry out. Why not? You know, everybody got used to that for a couple of years there, so you know it's just as good. Everybody's got the whole process perfected. Why is this so important to Family Service and Guidance Center?
Yeah. Proceeds from Meals for Mental Health will go towards our new Youth Crisis and Recovery Center building. It is very close to completion, we are very pleased to say. Looking to open. Our ribbon cutting will be October 4th.
Oh, wow. That is close to opening.
It's very close, very close. So all of the proceeds will go to help kids and families who are in crisis, have severe mental health challenges, and substance use disorders. So very worthwhile event, tasty treat, but really what it's all about is helping, you know, the kids and families who are struggling.
For those who aren't familiar with why this inpatient youth crisis center is so vital and so groundbreaking for our area, fill us in. Why is this such a great thing that we're going to have?
So we have seen an increase in the severity of crises that kids are having. You know, they're talking and thinking about taking their own lives. They are dealing with depression and trying to self-medicate with substances. And since we've seen these increases, FSGC didn't feel like we could sit back, and we wanted to keep kids and families close. And this new facility is going to be like no other in the area.
When you mention that you want to keep kids and family close, the reason is because currently, if someone is a minor, child or adolescent who has that crisis, where can they find an inpatient bed? Do we have any in Topeka?
So technically we do have some beds, but they are a maximum of a 3-day stay. So that is short term, that is lower acuity, if you will. But with the new building, the maximum length of stay will move to 28 days.
And the bottom line is we just don't have a lot of those beds for young people.
Exactly. And the needs just to continue to grow. So this is just going to grow capacity just to help more kids and families.
And we should mention that you also have a lot of great programs for folks who are even trying to get some preventative care and things to address the challenges before it gets to that crisis level. So check you guys out for all of that.
Absolutely. Encourage everyone to go to the main website. Lots of basic information, fsgctopeka.com. And if they want to buy tickets,
that's where you go.
There we
Slash
go.
meals
Slash
to get to the
meals.
tickets. Just $20 plus tax. You do have some discounts if someone wants to go with a group of 15, 20, the larger groups. That information is all there. And again, it's Texas Roadhouse, the 1st to the 31st. But get your tickets because it's possible they could sell out. Texas Roadhouse has been very generous, and there are a lot of tickets available. So get to the website and do that now. Pam, thank you. Appreciate it. And all the best. I'm sure we'll be there for the ribbon cutting to celebrate with you in just a couple weeks.
Look forward to it.
Thanks. That is a great partnership for Family Service and Guidance Center and Texas Roadhouse to have. Another great partnership we've been proud to have here on WIBW TV is with Patterson Legal Group, and Patterson Legal has a program that they call Patterson Gives Back. About once a month, they invite a local nonprofit to our studios, and they give them a presentation of a financial donation. And normally we don't include those here on the podcast. They're pretty local. But this month, the presentation was to First Congregational Church in Topeka and their pastor, Tobias Schlingensiepen. Tyler Patterson presented them with this month's Gives Back Award to help them with their outreach programs. And there's one in particular that serves a very unique need. So I want to share that with you today. Welcome back to you, Tyler. Welcome back to you, Tobias, as well. You were here recently talking about some of the different things that your church does. You have a lot of outreach programs. What are some of those?
We do. So we've just started preparations for a new shelter for LGBTQ youth called Braided Haven, and we've secured the building, and we're now putting it into shape, and hope to go online January 1. And we have another program that reaches out to Hispanic members of the community who need to learn English or prepare for citizenship exams, or who need to find work, and that's the VITA ministry. We have a program that helps low-income seniors who are ticketed for code violations in the city paint their houses and get their yards in shape. We've been doing that for many years. Just a whole lot of things of that nature.
It's a lot of things, and it's interesting to me because I think a lot of times people think about a church as a place that they go to, and you're looking at your church as a place that goes out. Why is that approach important to you?
Because we always say, no matter who you are, where you're on life's journey, you're welcome here, but we see that as something we have to reverse, and we want our community to look like that. And so we want to go out and do things with other people in the community. It's interesting, Washburn University is a university that the Congregationalists founded, and its motto is, not for us alone. And that's really been the philosophy of the Congregational churches from the beginning. We're small, but we like to do things that help the community, like create Brewster Place and Washburn University and all kinds of other things.
Those are big things.
Those are big things, but those are part of our history. That's part of our footprint. We've always been small, but we really care about things that benefit the whole community.
And in order to achieve those things, it does take support, and so that is why Tyler is here today. What do you have?
That's right. So we've got a check today for $1,000 to really recognize the life-changing work that you guys are doing.
Thank you so much.
What was it that resonated when you first heard about the work of the Topeka First Congregational Church and what you could do to impact that?
So I've talked quite a bit about Braided Haven with some of the members behind it, and it's really just inspiring, and it's unfortunately that there's a need for that in the community. You don't want there to be a need, but that's when you can step into a kid's life when they're potentially kicked out of their home. It's just so important. So, it's really great what you guys are doing.
And Tobias, as you grab onto a $1,000 check, what does that mean to you? Don't make Tyler hold it alone. What does this mean to the work that you're going to be able to do?
Well, Patterson has a reputation of being supportive of initiatives in the community, and so it means a lot to us that you're here presenting this today. And that's exactly what we strive for, is to partner with other groups and people, and just to be a community that is active in our community with others.
And Tyler, as you think about what you can do to impact others, if anyone out there has an organization that they'd like to suggest for your program, what can they do?
Sure, just go to pattersongivesback.org, and there's a form where you can nominate a nonprofit. Just tell us a little bit about what they're doing in the community, and they might be chosen.
Well, I like being able to facilitate presentations of big giant checks. So
We appreciate it.
Patterson Gives Back is where you can go to nominate an organization. And remind us again, Tobias, the Braided Haven, when is that going to open? Are you hoping?
We're hoping the shelter will go online January 1. The walk-in center will be open before that, and we're already doing work. So.
And you can just look up the church and reach out to them if you think any of these programs are something that you could perhaps either volunteer with, or if you need those services, they're there to help. Tobias, Tyler, thank you both. Appreciate you being here. Remember the Patterson Gives Back website if you know a deserving nonprofit that could use a little extra boost. We wrap things up today with a fun exhibit that just opened at the Kansas Children's Discovery Center. It's an exhibit based on the stories of Curious George, and it really gets kids involved. Of course, the grand opening was this week, so some of that information here, you've missed the grand opening, but the exhibit itself is going to be in Topeka at the Kansas Children's Discovery Center for several months. So let's hear Danae Mosier of the KCDC tell us the details. This is a lot of fun. We're so excited. Who is coming to visit tomorrow?
Tomorrow is the big day. Curious George will be at the Discovery Center. He arrives tomorrow and his exhibit will be here through early January.
Now, is Curious George himself, is he going to be kind of in and out throughout the exhibit?
Yes, he will be on site tomorrow. We open the doors at 9 and Curious George will be there to open up, and then he will make appearances throughout the stay of the exhibit, and you can see those on our website.
A lot of people have heard of Curious George, but how do you make this into a whole exhibit? What can people expect?
It's an incredible exhibit. It was created by the Minnesota Children's Museum in partnership with PBS, and families will come and they get to walk right into Curious George's neighborhood. They will see things that they recognize from the books and the series. They can help Curious George climb an apartment building and clean the windows and get into a little bit of trouble exploring and investigating just like he does. Everything is hands-on.
Now, they're not climbing like a high rise. It's like safe climbing that the kids are going to do.
Well, George is the one climbing.
Okay.
They will control
I was
the
worried
ropes
you're going to send
and
children
pulleys.
up, you know.
No, everything is fun with your feet on the ground.
Okay. The ropes and pulleys, because this is about what? Science, math, learning?
And engineering, yes. So the kids will come in, everything in there is STEM. So science, technology, engineering, and math. They will be able to work in a construction site where they can move things through a series of conveyors and augers and pulleys and move things around. They can visit his apartment building. There's an elevator, so they can open all the windows and close them. They can go to a neighborhood market. There's a park where they can read some of his stories. They can play miniature golf. And figure out what happens if the putting green changes or it starts to spin in different directions, and really puts the kids in control.
Okay, that sounds like something the adults would want to get their lesson in. And you said there are things that you just brought some cookies that have kind of the design, but there's the man in the yellow hat is going to be there. That's the yellow and back. The balloons, just like you would expect from Curious George, and of course Curious George himself.
Yes.
Who developed this, and how big a deal is it to have this in Topeka?
Well, this is a nationally traveling exhibit. It has been all over. It's been in Washington, D.C. at the National Children's Museum. It's recently been at the Miami Children's Museum, and it was created by the Children's Museum of Minnesota, and we've hosted some of theirs before. Families will remember Storyland that they had last year that was very popular, and so this is a really wonderful quality exhibit that is so engaging and lots of fun.
It is also very fun because is there an extra fee for this?
No, this is included with admission. So when families come in, this is part of the experience. Anytime the museum is open, the exhibit will be open.
Which is so much fun. What is your hope that families will walk away from with this?
I hope that they walk away with an engaging experience that gives them lots of laughs, lots of exploration, lots of discovery through just testing and trial and error.
And it's going to be here for quite some time. So you can go several times and keep exploring, because Curious George, let's get curious. That's a little taste of what the exhibit looks like. Opens tomorrow, 9 a.m. at the Kansas Children's Discovery Center, and it'll be in town through January 7th. Regular admission is all that applies here, so no extra fees to check out Curious George's neighborhood. The Kansas Children's Discovery Center, in case you're not familiar, is over there on the south end of Gage Park, so go check it out. Super fun for your family to check out that exhibit at the Kansas Children's Discovery Center. It's been a fantastic addition to all of the facilities located at Gage Park in Topeka. If you'd like to see the videos from these segments or any of the segments, like I said, it has been a busy week on Eye on Northeast Kansas. Just head to our WIBW.com website. I also post them on my Facebook page, WIBW Melissa Bruner. You can see the selfies in the studio that we collect with all of our visitors there as well. Plus, all the segments. You can just kind of keep going back through the months and see who we've all had come through. That's on our WIBW 13 News YouTube channel. Be sure to click subscribe while you're there. Thanks so much for subscribing to Eye on Northeast Kansas, the podcast as well. We're glad to have you with us and listening as you make your drive around town. Remember to tune in Monday through Friday, 4 o'clock Central Time on WIBW.com. Have a great week, and we'll see you on the Red Couch.